Hello everyone. This is Hello everyone. This is group 19 of EEMT5220 Six Sigma Quality Management. Our topic is AI-driven clinic process optimization at HKUST Health Center. As the saying goes, kicks an apple a day keeps the doctor away. But sometimes you don't have an apple or the apple just didn't work. And let's start with a video. As you can see, when you got sick, you come to the clinic and you see mass people and you know that you don't have the healthcare quick. And for the define phase, we use the process map of medical assistants in school clinic. And you can see from the process map that you have to go through a lot of procedures before you get actually medical help, which is not good for you because you feel not good.
Hello everyone, my name is Zhang Yixin. It's my part about the measures of our topic. First, we can see our data collection plans. Our primary objective is to identify the factors contributed to long waiting times and low patient satisfaction. So we focus on the key indicators such as average waiting time, satisfactory with waiting time, our satisfaction, and the communication. To capture these indicators, we designed a cross-sectional questionnaire and conducted small interviews during our service. Our target response was both scheduled patients and walk-ins. We aimed for about 100 responses, ensuring the volunteer participation. You can see this slide shows our questionnaire. It covers four sections: appointment information, waiting time, satisfaction, likelihood to recommend suggestions for improving. Then we can see our process maps. We applied the Six Sigma DMAIC circle to the correlations analyzed to link waiting time with satisfaction. And then we can see our control charts. The first chart of our control chart is the average patient waiting time at HKUST Health Center. The chart shows that the trend of average patient waiting time over 12 days. After the QUI system was launched on day 7, the waiting time dropped and remained within control limits, indicating that the process improvement was effective and stable. Then we can see our second chart is patient satisfaction scores over 12 days. We can see it's showing the process optimization not only improved efficiency, but also significantly enhanced the patient's experience. Then I combined the two charts into the final chart. It shows our program is impactful.
I will now walk you through the analysis of our project. After defining the problem and measuring the current state, we move into a deep dive analysis to identify the root causes of long waiting times at the HKUST Health Center. First, you can see our fishbone diagram. This allowed us to visibly map all potential causes across 4 key categories. To pinpoint the most significant issues from this list, we use a Pareto chart. The analysis clearly showed that the inefficient booking system and poor appointment scheduling were the vital few causes, accounting for over 60% of the problem. This told us precisely where to focus our improvement efforts. And through scatter plot and regression analysis, we clearly identified the drivers of total visit time. The data shows a remarkable strong correlation between waiting time and total time, with a coefficient of 0.98. This means for every minute increase in waiting time, the total time increases almost in lockstep. This finding sends a clear message. The variation in total visit time is almost entirely driven by the waiting stage. Therefore, if we want to significantly reduce total patient time, we must prioritize optimizing the queen and quiz matching. Then our individual control chart reveals another critical insight. The chart shows that the current process is stable with all data points within control limits. However, this stability is what we call stably bad, because the process average is as high as 52 minutes, far exceeding our target. This indicates that the problem is embedded within the system itself, not caused by random events. Merely managing daily variations is not enough. We need to achieve breakthrough improvements through fundamental process changes, such as introducing an AI-powered scheduling and a queuing system. In summary, our analysis has not only pinpointed the cause problem, but also charted the path forward. We must focus our efforts on structural reform of the waiting process.
Hello everyone, this is Yang Liyu, and let me show you the improvement path. First, we can combine DOE with AI. For the traditional way, DOE has some drawbacks. For example, it requires failed trials and which are costly and time-consuming. But with the AI enhancement, we can stimulate different combinations of variables of AI stimulation. For example, we stimulating the effect of increasing online appointment versus optimizing strategy logic. And here is the result generated by AI. And what AI can do is more than that. We can have the AI-based improvements. For example, we use AIGC2 to give us some improved suggestions. Here is 3 suggestions generated by AIGC, and it said we can launch of the intelligent appointment system and building a dynamic querying algorithm, and so is the AI strategy assistant. And we use AI after that to do some expectation generation after our implementation of these suggestions. And it said if we imply these suggestions, or we could decrease 30% of the waiting time as well as increase 20% of the patient satisfactory. That's it.
Now I will introduce the control phase of our DMAG project. The main objective of the control phase is to make sure that the reduction in waiting time at the HKUST Health Center is sustained over the long term, instead of going back to the old level. In our project, we defined several key metrics to monitor. The main outcome metric is the average waiting time. In addition, we monitor the online booking rate, the no-show rate, and the patient satisfaction score. These indicators help us understand both the final result and the behavior of the process behind it. Based on these metrics, we designed a control plan. For each metric, we specify the target, the monitoring frequency, and the responsible owner. For example, average waiting time is monitored daily by the front desk supervisor and the operations manager, with a target of 20 minutes and an upper control limit of 30 minutes. When the result exceeds this limit for more than 2 days, the team is required to review the appointment structure and adjust staffing or time slots. We also use statistical process control. This control chart shows the 12-week trend of average waiting time after the improvement. The center line is around 20 minutes, and the upper control limit is 30 minutes. All data points are within the control limits, and there are no obvious abnormal trends, which indicates that the new process is stable. To support daily monitoring, we built an AI-driven dashboard. It automatically pulls data from the appointment system and satisfaction surveys and displays today's waiting time, online booking rate, and satisfaction score. The dashboard also flags abnormal days, for example, very long queues or a sudden drop in online bookings, so that managers can react quickly. Finally, we created standard operating procedures, or SOPs, and checklists for the front desk and the operations team, some of them drafted with the help of LLM tools. These routines define what to check every day, every week, and every month, and how to respond when the process goes out of control. In this way, our control phase does not just deliver a one-time improvement, but builds a system that can sustain the gains and support continuous improvement in the future.